Hi everyone, here's Meilan Shuai. Today I'm so honored to be here and share my manuscript with you guys. I'm from Beijing 21st Century School. So here's my topic, the impact of previous adverse experiences on substance use disorder, a narrative review. Okay, my presentation is basically divided into three parts. Part 1, introduce two key terms. Part 2, my study. And Part 3, limitations and future prospects. So here we come Part 1. What is adverse experiences and substance use disorder? So, adverse experiences also refers to ACEs. ACEs are globally pervasive encompassing abuse, neglect, and family dysfunctions before the age of 18, with injury consequences for both physical and mental health. Well, I think a lot of people might confuse between childhood trauma and ACEs. So, childhood trauma is just a bad thing happened during your childhood, which could give you a positive or negative punishment later in life. So you might have the bad feelings or impression toward a specific item or place or event or even the people. But ACE is totally different. ACE are particularly traumatic exposure to abuse, ignore, severe domestic violence, or parents with mental health challenges or SUD, even addicted in drug use. Early childhood is a necessary growing period during the development, with ACE have long-term effect on psychological health, especially the child with lower socio-economic status families and depressive growing environments in early childhood, which the potential of negative health situations, psychological disorders, and passive value later in life. So, indirect influences are should critically pay attention. Some of the aspects may have profound impact on future socio-economic status, health behaviors, and coping mechanisms through the development of social, economic, behavioral, and psychological pathways. Well, some of the research they found that people who experienced more ACEs in childhood had a higher risk of developing a variety of physical and mental disorders in adulthood, such as cardiovascular disease, anxiety, depression, suicidal tendencies, cancer, alcoholism, substance abuse, obesity, high blood pressure, sexually transmitted diseases, and a higher risk of being a victim of domestic violence, and the higher risk of chances of feeling bad in your career. But, okay, so you have to remember, if your ACE score is high, it doesn't necessarily mean that you will develop some psychosomatic illness. It just means that you are more emotionally stressed as a child, and you are at the greater risk of developing these psychosomatic disorders as an adult than the others. So that's basically the situations of ACEs. Here we come SUD. I think you might more familiar with this term. SUD is a problematic pattern of substance use that affects your health and well-being. Some of the most common substances include alcohol, opioids, marijuana, and can range from mild to severe, which is addiction. Okay, so here we come our research condition. People who experience more ACEs in childhood had a higher risk of developing a variety of physical and mental disorders in adulthood, as I just above mentioned. However, this specific relationship between ACEs and SUDs, particularly the differences across age groups, has yet to be fully explored. So, due to the lack of effective and standardized ACE assessment tools, the causal relationship between these two terms still remains unclear. So here we come my study. So my study, the findings indicate a positive relationship between ACEs and the severity of SUDs in the adolescent, adult, elderly, and sexual minority group, with this relationship remaining consistent and different across different cultures and populations. So I have selected 5 manuscripts through several eligibility criteria. So number one, it should be public in both English and Chinese languages. Number two, it should be quantitative research. Number three, the participants have to be diversity. The last but not the least, articles should be published between the year of 1997 and 2022. Okay, so here's 5 manuscripts that I selected. The first one came in 2021. The mainly focus on elderly population. Chang 2019, the adult population. Brilliant 2020, the focus on behavioral health patients. Bomisud 2020, they are mainly focused on teenagers. And June 2022, they focus on sexual minority populations, which refers to lesbian. Okay, so here's the table that I generate these 5 papers. So I have choose the sample size, sample type, age, the percentage of male and female, number of AC type measure, and HUD diagnosis measure, and generate a table. Okay, let's take a look. So the first paper, in the elderly population, a study using data from the National Epidemiologic Survey on alcohol and related conditions, explored the pattern of ACEs and their relationship with depression and SUDs in a sample of 11,386 individuals aged 55 and above. Second, in the adult population, a cross-sectional study in Meilan, China, examined the association between ACEs and health behaviors, chronic diseases, and mental health in a sample of 1,501 individuals aged 18 to 59. The third study, among behavioral health patients, a study of 4,378 individuals from a community health center in Connecticut, explored the relationship between ACEs and SUDs. Using a 10-item ACE scale, this study evaluated ACE exposure and found that 4.8% of participants had experienced at least one ACE, while 49.1% had a score of 4 or higher. So, the fourth study, in the adolescent population, like me, a study examined the association between ACEs and mental health conditions among 29,617 adolescents aged 12 to 17 using data from the 2016 to 2017 National Survey of Children's Health. The last study, in the sexual minority populations, a survey conducted in Beijing studied the relationship between ACEs and substance use behaviors in 394 sexual minority individuals. Okay, I bet you guys are really pretty familiar with these data and statistics. So I want to emphasize some limitations and future prospects. So I have selected 4 limitations. First, study design limitations are significant, as many relies on cross-sectional approaches that cannot establish a causal link between ACEs and SUDs. Secondly, the ACE assessment tools. So the measurement tools for ACEs has really limited Existing studies mainly use ACE scales developed for adult populations with limited validity evidence for use in children. Although some studies assess ACEs in children by asking their parents, parental knowledge may be insufficient or stigma may prevent accurate reporting, thus leading to an underestimation of ACE's prevalence. The study scope and inclusion criteria are also limited. Most research adopts narrow definitions of ACEs, neglecting other forms of abuse or neglect linked to ASUDs. Furthermore, some studies examine only ASUDs, neglecting other psychological disorders linked to ACEs, which limits a comprehensive understanding of their effects. So talking about a stigma, my next paper is mainly about stigma, so people can expect that. A limitation in sample selection that is really obvious. The sample selection mainly from North America or Asian, but a lack of African and European sample. So besides, some study relies on small sample size or convenience sampling, like clinical samples. So in the future, maybe longitudinal studies are essential for establishing causal link between ACEs and ASUD, while cross-cultural comparisons can provide valuable insights into varying impacts of ACE across different societal contexts. Future research should also examine the association between ACEs and other mental health disorders to gain more comprehensive understanding of their long-term effects and to guide the development of effective interventions. So, overall, although the ACEs and ASUD studies are comprehensive and have a lot of people study on that, but I think in my country, in China, there are still lack of evidence and insufficient research focused on these fields. Yeah, just Bob mentioned, the longitudinal studies and future research should refine study designs, sample diversity, and develop standardized ACE assessment tools. Okay, so I also think that the association between ACEs and other mental health disorders like cardiovascular disease, anxiety, depression, things like that, it also should be more focused on that field. So that's basically my overall study. I hope you guys could enjoy that and can expect my future studies. Okay. Thank you guys. Bye bye.